Statewide, the number of opioid-related overdose deaths is decreasing by 4%, but in Worcester, the numbers continue to rise. The city and other services are working to help people addicted to drugs, but say unfortunately there is no quick fix. Our Chandler Walsh joins us now to explain. Chandler.
Olivia, a state report says there were 97 opioid-related overdose deaths in Worcester in 2018. This is significantly more than the year prior. The city says this will make people want to make more efforts in the crisis. Opioid-related overdose deaths in Worcester rose 21% from 2017 to 2018. The Massachusetts Department of Public Health released the data in a new report this week.
It just highlights that we still have an opiate crisis that we need to address, and we need to look at access and treatment.
Worcester's Health and Human Services Commissioner Dr. Maddie Castile says they've been following the numbers all along. The city has many prevention and treatment initiatives through trainings, campaigns, and task forces.
A lot of this stuff didn't start to happen until 2015. There's a whole lot of stigma in our community regarding opioid use and what people feel, and did they do this to themselves?
Castile says the opiate crisis won't be a quick fix. She says they're still working to address things like drug use in school-aged individuals and in jails.
How do we deal with trauma in the kids? How do we look at working with them in their homes? What's happening there? So it's a process of changing that piece. It's not going to change overnight. And if we've been incarcerating for years, that reversal is going to take a long time to happen.
AdCare Hospital uses data from the state to educate their patients. Clinician Susan Hillis says locally, the number of people they're seeing is on the rise.
I think that we are getting patients that are talking about overdosing and that they've overdosed and have needed Narcan a number of times.
The city is looking into more programs like a mobile prevention van. It would provide outreach to overdose hotspots.
There's only 20% of people that are accessing care who have addiction. 80% of the people, we're not even touching them. So we have to go out to them, and we have to find them, and we have to start providing care.
The Massachusetts Department of Public Health also says the presence of fentanyl is increasing. In 2018, it was present in 89% of overdose deaths across the state. Chandler Walsh, Worcester News Tonight.